thought they were doing the right thing by calling the police when she has.
First, I'd like to extend my deepest condolences to the friends and family, just all the loved ones of Brianna Greer. It's completely unacceptable, the outcome, the things that happened to her, and so may she rest in peace. If you are having a mental health crisis or someone you love, neighbor, is having it, the first thing I would do is think about calling 988. That's the National Crisis Suicide Prevention hotline number. The person responding to that call is going to be able to get information, assess the situation, and help facilitate the next thing that needs to happen, even if that ultimately ends up being reaching out to 911. In Georgia, we have GCAL, GCAL. That's the Georgia Crisis and Access Line. Calling that number will facilitate a mental health response team coming physically to your location to help, again, triage, assess the situation, and deciding the next best plan of care. If it's safe to do so for yourself and for the person that you're caring for, you can just directly take them to the nearest emergency room. Even if the mental health resources are limited in that emergency department, you know that you will at least be connected to a healthcare team, and then they can help facilitate the person being transferred to a psychiatric facility or the next level of care that they need to go to. I would say as a last resort to call 911. When you do specifically request an ambulance, let them know that the patient is having a mental health crisis. If you know their diagnosis, whether or not they've been taking their medication, if they have access to weapons, that is all very useful information to communicate to the dispatcher. If you know the person has weapons, please do communicate that information because depending on the nature of the situation, responding to a call can be very dangerous for the patient, clearly, and also for the officer. So the information that you have to communicate that's pertinent will be very helpful. And just know that when we invite the police into a situation where there's a person with a mental health crisis, it's obvious, but they are not trained mental health professionals. Some police officers are CIT trained, that's crisis intervention team training, and that is a specialized training for police officers when responding to mental health and or brain injury type of situations. Some police officers are trained in that, but it's not so completely widespread. So when we invite the police officers, we just have to know and appreciate that they're coming to enforce the law. They're not trained mental health professionals. Some are better than others when it comes to de-escalating situations, maybe assisting with transport to a hospital or to a psychiatric facility if that's necessary, but that's not always the outcome. Unfortunately, being arrested is too often the outcome when people have a mental health condition. So I would say invite the police to these types of situations, as a last